Well, understanding the COVID-19 pathogenesis and its impact on immunity has been a very highly spoken subject during the COVID-19 pandemic. So that is the time where this all alternative and the complementary medicines came into a topic. As you know, the alternative medicines and the complementary medicines and the theories of the indigenous medicines has revolutionized the world with its efficacy, especially during that time. And it became very popular mainly because of this COVID-19 pandemic, and it became a very popular concept demands by the patients. And as you know, there has been a special patient population in the world who demands this type of complementary modalities like Ayur, homeopathy, acupuncture, traditional Chinese medicines. So that was mainly because of its immune enhancing effect on these particular modalities. And as far as this immune enhancing property is concerned, with the alternative medicine that has been greatly discussed in Ayurveda and the traditional Chinese medicines and in acupuncture. So we call it the Vyadhi Shamatava in Ayurveda. And you know, we have a natural healing mechanism within our body. So main intention of these applications of these alternative medicine is to reinforce that particular vital energy, what we call chi, to boost to a level, even though the patient is getting exposed to this kind of virus, that the natural immune enhancing forces will be strengthened by these medicines.
So, as a medical officer, doctor, so we also little doctors, we also little, we didn't have much evidence and much experience about that kind of a management, about that kind of a disease. I think I still believe we are the best people to control it because we are island. We have only two entry points, like the airport and the port. And we had a lot of, as medical officers, as managers, and as the administrators, we have a lot of discussions still happening, whether we are done correct and whether we have to do, we can beat it.
Maybe one reason behind this is we have had young people, age 18 to 40, most of the time. Very seldom we had a officer who goes beyond 50 or 55. So I think managing the young people is quite easy. The mature people is asymptomatic. But I would like to talk not the management. I have the right to talk of management because I involved in the management, but the latter outcome of COVID-19 infected individuals. Even though we have not done a scientific study with regards to exercise tolerance of these young people, it's observed that most of the people's exercise tolerance has gone down. Why I say so, we annually have a physical endurance test in the Sri Lanka.
And the parents and personalities without schooling, so that's the thing. Mental stress is the thing. Other than that, the severity of the disease. If you are thinking that I will be okay and this and that, once you get the disease, you will face a huge problem with your family, with yourself, and so much of like death rate was high at some time at the country. So prevention was our intention, because we were asking, as a doctor, if I said, we were asking our patients to do this herbal smoking using this the vehicle, that means leaves of lime. That means basically the main drug that we were prescribing patients for those to preventive care was basically the Rutaceae family leaves. That means citrus. Citrus was the main thing because vitamin C. Because it says, it has proven that the anti-inflammatory action of this citrus family plants and not had a very positive effect in controlling and stopping and preventing this disease. So,
from the Postgraduate Institute of Management and is an MCGP. Also we have
Dr. Dammika he is the head of High Performances Unit, Institute of Sports Medicine. He is a physician for the Sri Lanka Athletic Association. And we have Dr. Buddhika Lokugamhewa, Registrar in Sports and Exercise Medicine, Commander of the Sri Lanka Navy. And also, Dr. Saman Hettige, Ayurvedic traditional psychiatrist. So with this distinguished panel, I wish to start this discussion on complementary and alternative medicines used in COVID-19, sharing our clinical experiences. May I invite Dr. Upul Gunasekara-R from Police Hospital to start our discussion.
May I have a minute, please? While the moderator is introducing the panelists, nobody introduced the moderator. Moderator is Dr.Erantha De Mel. He's a Senate member. He's a neuroscientist, having his own clinic and neuroscience labs, and he has been with us for long. So he's a very eminent professor of behavioral science and cognitive science. So over to you, Professor Dimendra.
Thank you very much.
Thank you very much, sir. Good morning, everybody. And I thank all of you, especially the organizing committee, for inviting me for this panel discussion. My basic interest is in public preventive medicine. And I was the coordinator, I just coordinate the COVID management in the police hospital. Before that I worked in the ministry as a public relations officer. And my experience in the public health, I just start with public health to give a open platform for discussion. Sri Lanka is a country that we have achieved a lot of things in public health, preventive medicine. We are, even WHO take this as an example for the world. Sri Lanka and Cuba is one of the two countries in past discuss about it. We achieved many awards, like we have eradicated the polio, we eliminate malaria and neonatal tetanus, measles. Recent past we got all these certificates from WHO. So while we are doing that management, we got COVID. Right, that is the first in my lifetime first pandemic that I experienced as a medical officer, doctor. So we also little doctors, we also little we didn't have much evidence and much experience about that kind of a management, about that kind of a disease. I think I still believe we are the best people to control it because we are Ayur. And what type of practical challenges that as a human race we have to face. Now I invite Dr. Buddhika Lokugamhewa. He is the Registrar in Sports and Exercise Medicine and is the Commander of the Sri Lanka Navy, to give an introduction about his COVID-19 experience.
Thank you, sir, for the introduction. And I'm Dr. Buddhika Lokugamhewa, as he said. Sri Lanka Navy was one of the places which was badly hit by the COVID pandemic. You have seen in the news breaks where the number is frequently very rapidly goes very high. At the end of the first episode, we counted like nearly 9,000 naval personnel got infected. Those are like diagnosed cases. Maybe symptomatic, maybe asymptomatic. But I'm proud to say we have had only 2 deaths. Even one who goes beyond 50 or 55. So I mean, managing the young people is quite easy. The mature people are asymptomatic. But I would like to talk not the management. I have the right to talk of management because I involved in management, but the latter outcome of COVID-19 infected individuals. Even though we have not done a scientific study with regards to exercise tolerance of these young people, it's observed that most of the people's exercise tolerance has gone down. Why I say so, we annually have a physical endurance test in the Sri Lanka. So,
COVID-19 in terms of psychological and psychiatric aspects of the pandemic. Over to you, Dr. Hettige.
Thank you, Doctor. Good morning to everyone. Well, understanding the COVID-19 pathogenesis and its impact on immunity has been a very highly spoken subject during the COVID-19 pandemic. So that is the time where this all alternative and the complementary medicines came into a topic. As you know, the alternative medicines and the complementary medicines and the theories of the indigenous medicines has revolutionized the world with its efficacy, especially during that time. And it became very popular mainly because of this COVID-19 pandemic, and it became a very popular concept demands by the patients. And as you know, there has been a special patient population in the world who demands this type of complementary modalities like Ayur, homeopathy, acupuncture, traditional Chinese medicines. So that was mainly because of its immune enhancing effect on these particular modalities. You know, this coriander came into the topic, kotamali, and these different herbs and their antiviral effects has been proven, antibacterial effects have been proven by the research. So my experience when this COVID-19 pandemic initially came into Sri Lanka, proclaimed nearly 2 million people. So I personally manage psychiatric patients, psychiatric indoor patients, and I own the Sri Lankan first Ayurvedic psychiatric hospital where 40 patients can be accommodated, and this has been a very brand new experience for our team, myself and my in-house doctors, because they were mainly psychiatric patients. So they didn't want to get themselves quarantined, and we can't keep them, confined to one room. So they will not allow and adhere to these certain guidelines and wearing the face mask and all that. So that was a very difficult task for us, even we didn't have much experience. And the other thing is, when this came at the initial stage, for my personal experience, not getting infected by COVID-19 was not a problem. The most the fearful experience is getting it diagnosed. When at the initial stage the PHI comes to our place and there was a banner placed on our gate or a wall, so we are quarantined, the people look at it in a different way, we can't go out. So that was like a stigma for us at the initial stage. So let me share one of the first experience that I had. So we were trying to manage them in the hospital, and there was an admission one day, and after that patient was admitted, there was a wave started from the fish market, and the patient's father was a fish vendor. Suddenly we got panic. The patient was admitted. After 2 days of admission, we came to know that father was infected, and I was informed by the mother. So after another 3 or 4 days that we came to know, the patient's mother also got infected and the grandfather also get infected. So as soon as we get the information, we started all our medicines. At that time, as far as I remember, vaccine was not invented, and we started all our medicines. right? So 2-3 days, we carefully observed the patients and he didn't have any symptoms, and the whole family got infected, right? So we have now in our place at that time there were nearly 30-35 indoor patients, so we just wanted to get them also protected. So we started the medicine which can boost the immunity of the patients, and we had certain formulas at that time, and we started giving acupuncture also for them, and thank God, and these patients were survived without getting any symptoms, not only him, because when we tell them don't go outside, don't get closer to other patients, just try to keep maintaining wearing your mask, no, they never adhere to these guidelines. Just touch each other, they stay in one room, but thank God we were able to manage without any problem. So when they were managing this type of patients in their hospital, we had a great demand, doctor, can I get that formula? So my husband is being treated at the hospital, my wife is being treated at the hospital, and can we give this to these patients, So we had certain intake formulas and all that. While these medicines are being continued, and most of the patients, they give our formulas as well. I don't know whether it has come into notice by the doctors, whether they know. And preventive part, I think the alternative medicine, especially Ayurveda, has done a great job in Sri Lanka. At the first phase, we were able to manage it very safely without going to the severe stage, but we were badly affected when the second wave came to the Sri Lanka. And I think Ayurveda and other alternative medicine and homeopathy as well, and played a very important and vital role as far as the COVID management is concerned in Sri Lanka. And then the preventive aspect and the post-COVID symptoms we were experiencing a lot. The patient, those who were infected, they were claiming of depressive features after they were get affected by the COVID-19 infections, and so they were complaining of sleep deprivations, and they were complaining of mood problems, and they are lethargic, they are very anhedonic, and they can't sleep. And I'm not quite sure whether it is really because of the COVID-19 infection, and we have noticed, and there were certain cases after the vaccine has been started, right? There were many physical symptoms and the psychological symptoms as well. So we were able to safely and effectively manage that type of post-COVID symptoms when they were coming to us with those complaints. So with that, my first experience, we have had many patients who were closely contacted with the positive cases, but thank God, none of our patients were positive. When I said none of our patients were positive, because we didn't test them while they were being treated. Probably they might get infected, but their symptoms were not that worse up to a level where they should get admitted to a hospital or where we need to give Western medicine. So we were able to, because we didn't close, at least one day our hospital was continuously working, and we didn't have any complications during that time. We were able to safely and effectively manage the patient. Up to now, there hasn't been any case within our hospital, but there were certain instances that we have noticed the symptoms clinically which were closely related to COVID-19, but we were able to manage with our medicine. And as far as this immune enhancing properties concerned with the alternative medicine that has been greatly discussed in Ayurveda and the traditional Chinese medicines and in acupuncture, so we call it the Vyadi Shamatava in Ayurveda. And we have a natural healing mechanism within our body. So main intention of these applications of these alternative medicine is to reinforce that particular vital energy, what we call chi, to boost to a level, even though the patient is getting exposed to this kind of virus, that the natural immune enhancing forces will be strengthened by these medicines. So the patient will not get, and even the patient will get infected by this virus, and this natural healing mechanism comes into play, and it has the ability to defeat that virus, and there won't be any symptom. For example, like the people, those who have studied acupuncture and the traditional Chinese medicines, we have different types of qi within our body, and the qi which is responsible for maintaining our immune enhancing function is what we call the defensive qi, Wei qi. Right? So Wei qi, it says the Wei qi is mainly associated in the superficial aspect of our skin, and it is ready to combat with this kind of viruses, and there are certain instances and there are certain circumstances that this Wei qi might get weak. So when you are going through a stressful period, when you are having this type of diseases, once that is, if you can maintain that particular chi into a very strong level, so you can expose to this kind of virus without any complication. So that is when it comes to the traditional Chinese medicine. So as far as the physiological effects of acupuncture is concerned, there are many physiological effects, and these immune enhancing properties has been scientifically proven. How our immunity level goes up, how these IgG levels goes up, and these points are being stimulated, and the homeostasis effect of acupuncture has been widely discussed and was proven by the scientific research. So these modalities have been widely practiced all over the world when it comes to the management of COVID during the pandemic period.
Thank you very much, Dr. Hettige, for that very informative insight to COVID-19. Next, I would like to invite Dr.Sadali Narathota. She holds a BASM honors and reading for her masters in general medicine and higher chikitsa. She is a lecturer in research methodology. I invite Dr. Narathota to address.
Good morning, everyone. So today we are discussing about this COVID-19 pandemic, how that has influenced all of our lives. So at that time, that means it was like initially it was in 2019, and we didn't actually take that too much to consideration because it was not affecting Sri Lanka at that moment. So after 2019 December, it gradually came. So if I take my personal experience, at that time I was working at the Institute of Indigenous Medicine, University of Colombo as a demonstrator. So at that time, our students actually, we were so, lecturers, students, all of them were very frustrated because all the exams, stress, because that's basically regarding the stress, and they are the natural thing, and we were having that problem as well. So we were thinking about what to do, because we were, as the sir said, we were so like worried, what if I get positive and everyone, all the family will get quarantined and all, and food, and we will not be allowed, like as the COVID guidelines mentioned, all the quarantine people you have to stay at the home for 1 week, 2 weeks, in that way. So in that case, again, mental stress is there because for students and to parents and for small kids without schooling, so that's the thing. Mental stress is so preventing. That means like practicing all these recommended guidelines and doing this healthy food. Because as the sir mentioned, immunity maintenance is the main thing. Because if you are having a good immunity, that means in Ayur it's Vyadishamatva, so we will be able to stay away from diseases. So rather than thinking I will be okay, it's better to practice good healthy diets, dietary patterns and good behaviors. Overthinking is anyway, it's a bad thing for our physical as well as mental health. So thinking the positive aspect of all will help. It helped, and I think We don't know about the future and not if there will be another virus.